The opioid crisis did not go away during the pandemic. Instead, doctors fear progress made fighting the disease may have stalled. The Biden administration now feeling pressured to address the opioid crisis after overdoses hit record numbers. The National Desk's Angelo Brown joins us right now for our Addicted in America series. Angela?
And Jen, we interviewed Assistant Secretary of Health, Dr. Rachel Levine from Health and Human Services. The Biden administration is over 100 days into office, and Americans are losing their lives by the thousands. The White House is asking Congress for billions of dollars, but what is the administration doing right now to save lives? Is America losing the battle in the opioid crisis? Dr. Rachel Levine, HHS Assistant Secretary of Health.
I was just so concerned when I saw those numbers.
The numbers are grim. Over 90,000 drug overdose deaths from September 2019 to September 2020, the highest ever in a 12-month period in the United States. Clinical professors say fentanyl is driving the overdoses.
It's easier to get illicit opioids than it is to get maybe cigarettes underage.
After calls from lawmakers and doctors, the Biden administration announced new guidelines just last week, expanding access to buprenorphine, a drug that reduces opioid relapses and overdose deaths.
It treats the patient so that they don't go through withdrawal. And so they are able to stay on buprenorphine. They don't go through withdrawal. They don't have the cravings, the physiological cravings for the medicine that they would have otherwise. And it is just a very important tool towards recovery.
In the last several days after the guidelines were changed, Dr. Levine says the number of healthcare providers applying for a waiver to prescribe buprenorphine jumped.
This medication can be, for many people, the key to their recovery from opioid use disorder. We need to hire more professionals. We need more addiction medicine specialists.
But the Biden administration is far from having a handle on this crisis, especially illegal drugs crossing the border.
We need to work at preventing the influx of those illicit drugs, and particularly with fentanyl.
Last month, the White House requested over $10 billion from Congress to fight the opioid crisis and release their 7 priorities for 2021. But some addicts are feeling forgotten.
Treatment works. Recovery is possible, and we're going to do everything we can so that we can give hope to the patients who suffer from the disease of addiction.
And last month, the Biden-Harris administration released their drug policy priorities that included expanding access to evidence-based treatment, reducing the supply of illicit substances, and advancing racial equity in their drug policy. Jen, we are scheduled to interview the acting director of the White House Drug Control Policy to find out how they're going to make their plan a reality.